Hello, this is Dr. David Green, CEO of the Florida Pain Network. Today's topic is what you need to know about acute and chronic back pain. Back pain is the second most common reason for doctor visits, just behind the common cold. Half of all working Americans admit to having back pain each year, and it's the most common cause of disability worldwide. The direct and indirect cost of treatment, over $100 billion annually. Over 90% of Americans have back pain at some point in life. Thankfully, over 90% of that pain gets better no matter what you do between 6 and 12 weeks. Unfortunately, the 10% will end up with chronic back pain. Here's the definition. Acute back pain, 6 weeks or less. Subacute, 6 to 12 weeks. And chronic refers to back pain over 3 months. What are the causes? Well, there's soft tissue causes such as back sprain or strain, disc degeneration, bulging disc, or disc herniation. So here's what a normal disc looks like in a caricature. You can see that there's a harder outer layer called the annulus fibrosus. The inner layer is more gelatinous, and that's called the nucleus pulposus. People analogize it to a jelly donut. You have the inner jelly, which has no nerve endings and no pain, and then the outer harder jelly, the outer part of the donut, which does have nerve endings and can lead to pain. When you have degenerative disc disease, you should see here from the side, here's a healthy disc, here's a degenerative disc, and here's a disc that's basically gone. They get compressed and they can be painful because you can get little tears in the outer part. So when you start dealing with bulging disc, you can see it can start with these little tears in the annulus, okay? And it's almost like a flat tire when you start to lose air, or in this case water, in the disc from degeneration. It can start to bulge just like a tire starts to bulge as it gets flat. All right. If this tear becomes complete, you can end up with an actual disc herniation. And you can see here it's pinching on a nerve root as it tries to get out from the spine. And the redness refers to the inflammation that sparks up, and that can lead to sciatica. So if this situation can lead to simply back pain, this can lead to back pain and leg pain because of the nerve root getting pinched. Sciatica, here is shown in this cartoon, basically either a bulging disc that pinches on a nerve root or an actual disc herniation where the disc comes out. If that pinches the root, it can cause inflammation and lead to pain going down whatever that nerve root goes to. It could be the back of the leg, it could be the side of the leg, it could be the calf only. There's multiple nerve roots that lead, that L4, L5, and S1 that come together to form the sciatic nerve. Depending on which one of those is getting pinched, that's going to lead to various different symptoms. Now, bony causes of back pain, by far, number one is arthritis. You have arthritis of the joints in the back of the spine. That can lead to back pain in millions of Americans. SI joints, you can see here an SI joint. There are two. Where the sacrum meets up with the pelvis, which is called the ilium, sacroiliac joint, and that can become arthritic just like any other joint and lead to pain in this area or in the low back. Up to 25% of low back pain comes from SI joint problem. Scoliosis, degenerative scoliosis in adults, is a result of disc disease and joint arthritis, leading to asymmetric arthritis and a curve that results. This causes considerable back pain in a lot of cases. This is what a spondylolisthesis looks like. You have one vertebrae that slipped forward on the one below it. It could easily be this one on this one. But spondy means spine, listhesis means slip, and because of spinal degeneration, this can occur. Spondylolysis occurs mostly in younger individuals, such as those playing football, gymnastics, and other sports that have repetitive activities where the back goes into extension. This is a stress fracture of an area called the pars, okay? That can cause considerable back pain. A lot of times it can be treated without surgery by rest and bracing and medication, and this will just kind of burn out. The pain will go away. Spinal stenosis is when you get bony overgrowth or soft tissue from arthritis and it pinches on nerve roots. That often leads to pain in the buttock and thigh and down the leg, and sometimes back pain as well. Uncommon causes of back pain include infection. Fracture is not that uncommon. There's 1 million that occur a year due to osteoporosis. You can see what that tends to look like. and then potentially a tumor, either a primary like multiple myeloma or a metastatic tumor like from lung or prostate cancer. It can go into the back and cause pain. The top non-operative pain management for back pain is through the Florida Pain Network. There are many clinics throughout Florida in the network accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. In the Tampa area, visit us at painmanagementtampa.com and then call us for more information and scheduling at those locations, 813-666-4399. I'm Dr. David Green with the Florida Pain Network. Your pain stops here.